Hi everyone, welcome to my channel Caregivers. Today topic is obstruction of upper airway. It includes mainly 9 subheadings. Okay, so we'll see one by one now. First one, the definition of obstruction of upper airway. Okay, so narrowing or blockage of the passage from the nose and mouth to the lungs. Okay, so narrowing or blockage of the passage from nose to the lungs or mouth to the lungs, that is nothing but obstruction or obstruction of upper airway. Okay, it can be acute or chronic or partial or incomplete. It requires immediate medical attention due to its potentially fertile nature. Okay, so due to its potentially fertile nature, so it requires immediate medical attention. Second subheading is nothing but types or classification. Based on duration and location, two types it is classified. Okay, so duration, based on duration, it classified into acute or chronic. Okay, based on duration, acute and chronic it divided, and based on location, any part of the upper airway. The next one is nothing but pathophysiology. It shows how it was affected to our lungs. Okay, so involves blockage or narrowing in the nasal passage. It involves blockage or narrowing process in the parts of nasal passage or throat or larynx. Okay, then that will come in to reduce the airway flow. When it block or narrow the passage, next it will come to reduce the airway flow to the lungs, then finally potentially respiratory failure. Okay, the steps that involves the obstruction of upper airway. The next one is causes, how it cause to our body. First one, foreign bodies, infections, trauma, allergic reactions, certain medical conditions, inflammation, physical injuries. Based on these causes, the obstruction of upper airway will form. The next one is diagnostic evaluation. Diagnostic evaluation means what are the diagnosis is there to prove obstruction of upper airway. Okay, first we have to do physical examination of a patient or a person. Next, blood test. Based on some blood test we can notify that. Okay, next one, CT scan, MRI, endoscopy, and mainly pulmonary function test. Okay, these are the some main diagnosis to evaluate the disease. Next is nothing but management. In this management, there are two types: medical management and surgical management. Okay, so medical management defines it no need any operations. Okay, so through the medicine or through some procedure, it will come down. Okay, so if a person is what affected acute obstruction of upper airway, means we can reduce the symptoms, or we can reduce that condition through a medicines or through some procedures. Okay, this is known as medical management. Mainly there are airway support. We have to give airway support, endotracheal intubation. In airway support we can see endotracheal intubation. Second one, nebulized medications. Third one, antihistamines. And fourth one, antibiotics or antivirals. Okay, these are some medical management. Next we'll see the surgical management. Surgical management means it needs surgical procedure. In this itself you can notify that it needs operation. Okay, surgical treatment it needs. First one, tracheostomy. Second one, cricothyroidectomy. Third one, destruction osteogenesis. Fourth one, adenotonsillectomy. Okay, these are the main surgical management. Okay, so main last is nothing but last subheading is nothing but prevention. What are the prevention we can see in this topic is nothing but keeping small objects away from children. Okay, we should not keep any foreign objects like any balls or small balls like that, plastics instruments, small plastic instruments, that we should not keep near to children. We should keep away from children. Okay. Next, cutting food into small pieces. Okay. So when we are going to feed to children, we have to cut the food into small pieces. Okay. Then third one is nothing but ensuring dentures fit properly to prevent choking. So we have to check the denture alignment. Okay. Next, avoid excessive of alcohol. So we should avoid excessive alcohol. Okay, these are the main prevention we can see in this topic. Okay, thank you. Now I am going to give some words in this topic. Okay, you have to find the meaning and comment below. The first one is nothing but what is fertile and antihistamines, and third one is nothing but tracheostomy. What is tracheostomy? In a line. Okay, so we I no need that much of procedure to explain. I need in a line explanation. Okay. Next, cricothyroidotomy. Okay. Next, destruction osteogenesis and adenotonsillectomy. You have to find the meanings and you have to comment below. Thank you. Like, share and comment. Don't forget to subscribe my channel. Thank you for watching.